are excited to present the first Sylfirm X webinar in 2025. The topic of today's session is exploring the efficacy of Sylfirm X in treating melasma and improving skin texture, the clinical perspective. Before we dive into the session, I'm thrilled to introduce our speaker, Dr. Chen, a board-certified dermatologist in Taiwan and the chief of the Zador Aesthetic Medicine. And he's an active member of several prestigious organizations, including the Taiwanese Dermatological Association, the Laser and Photonics Medicine Society, and the American Academy of Aesthetic Medicine, among others. And he also contributes as a journal reviewer in the field of dermatology. And such a great and intensive background. And a quick note before we begin, he'll be holding a Q&A session after Dr. Chen's presentation. So please feel free to submit your questions at any time during the talk using the Q&A panel at the bottom of your screen. So he'll answer them at the end. So now, okay, we'll have him join in the webinar. Please welcome Dr. Chen. And Dr. Chen, the floor is yours now.
Okay, thank you. Good evening, everyone. Thanks for VO Company for having me here tonight. And also thanks for everyone for being with us today. Today I'm going to share my clinical experiences of using the Sylfirm X. And at the first slide, I want you to take a look at this typical melasma patient that we may encounter every day in our clinical practice. And these patients oftentimes presented with a certain extent of telangiectasia and unstable rebound hyperpigmentation, along with the confetti-like hypopigmentation, which may be due to the repetitive treatment procedures before. And for me, in my past 15 years of practice, I found that the melasma is really the most difficult to treat and the relapsing pigmentary disorder. And from the histological examination, and we can find that there's increased melanin deposition along the basal layer. And also, there's a plasmognomic sign of pendulous melanocytes in melasma skin. It means that the melanocytes are protruding into the dermis due to the disruption of the basement membrane. When we take a look at the electron microscope, we can also found that there's increased melanin transfer from melanocytes to the periphery of keratinocytes that contribute to the clinical pigmentation. And when we use the spatial staining to highlight the basement membrane, we can clearly observe the disruption of the basement membrane. And this phenomenon is also evident under electron microscope. And when we move to the dermis, we can also find extensive solar elastosis and different degrees of telangiectasis. And oftentimes we can also observe inflammatory infiltrates around the vasculatures in the epidermis. So melasma is now considered a photoaging disorder. And since the etiology of melasma is very complex, so this is why it's so difficult to treat. And when we take at this review article, we can really see that the crosstalks between the melanocytes and the adjacent cells, such as the keratinocytes, senescent fibroblasts, mast cells, and the endothelial cells, along with the influence of the hormone and UV exposure that makes the melanocytes really unstable. In the past, the treatment of melasma is mainly medical. The experts suggest that for mild melasma, we always suggest our patients to put on the sunscreens and take some oral antioxidants and prescribe the oral tranexamic acids. And also, we suggest the patients to use the topical tyrosinase inhibitors such as hydroquinone, kojic acid, the arbutin, and tretinoin. But for more moderate and severe melasma, experts suggest using the triple combination cream. And if the patient was unresponsive to the treatment, maybe we can add chemical pills. But as you can see in this chart, that the energy-based devices are always the last resort for the melasma patients. In the past few years, the Vivo company introduced a new non-insulated microneedle device called Sylfirm. And this bipolar non-insulated microneedle RF was very unique in that the electromagnetic energy is focused at the needle tip, and the thermal reaction propagates upward along the needle shaft. So they're creating a conical continuous coagulation zone. As the key characteristics of this null effect is that the coagulation column are vertically elongated and more focused and uniform, and with the interelectral regions show very minimal to no coagulation. And the effect is very precise, deeper, and thermally efficient compared to the conventional insulated microneedling. And when you take a look at this slide, the Sylfirm technology use the non-insulated needle that can really maximize the therapeutic effect compared to insulated one. And they also use the 2 megahertz radio frequency that generate higher concentration over the target tissue. 5 years ago, I started to use the first generation Sylfirm. At that time, they only provide a pulse wave uh, with 40 milliseconds on time and 10 milliseconds of time. With this specific type of pulse wave, we are able to transmit the electric current to the tissues that having the higher conductive rates, such as the blood vessels, fibroblasts, and basement membrane. The reason why I choose Sylfirm for the treatment of melasma is that from the past clinical evidence, we know that there's about 83 to 95% of patients suffering from melasma having the evidence of basement disruption. And also the 68.75% of the melasma skin is showing increased vasculature in the upper dermis. And also uh, in melasma skin, we also found 2.72 times increase of senescent fibroblast in the melasma skin. So this all increase the melanocyte activity. So theoretically, if we can treat these very important etiologies, we may be more efficiently successfully treating the melasma. In the following slides, I want to show you some clinical studies showing how the Sylfirm can improve some important etiologies that contribute to the melasma. The first is published in 2018. The authors used the Sylfirm, the microneedling system, and they found that after the treatment, that we can really increase the thickness of a basement membrane for the melasma patients and also cause the shrinkage of blood vessels. And the second study showed that with Sylfirm treatment, we can decrease the number of senescent cells in the upper dermis with increased expression of collagen 1. And these results were associated with the reduced epidermal pigmentation, both histologically and clinically. And another study also support the notion that the senescent fibroblasts can really drive the aging pigmentation. When we compare the senile lentigo skin with the perilesional normal skin, we can see that there are increased number of the senescent fibroblasts which can stand positively with the P16 here. And when we use the Sylfirm to treat our patients, we can decrease the number of these senescent cells, and with improvement of the basal hyperpigmentation of our patients. And you can see here the patient pigmentation improved clinically and histologically. So from the above evidence, we know that the Sylfirm is a novel stromal targeting therapy for aging pigmentary disorder that was quite from the past modalities using the laser systems to destroy the melanin. So with Sylfirm treatment, we can really improve some important etiologies that contribute to the melanocytes. Like they can repair the basement membrane. They can also disrupt. They can also destroy the senescent fibroblasts, and they can also decrease the endothelial cells, and also improve the solar elastosis. And hopefully, we can more efficiently decrease the activity of melanocytes that lead to the clinical improvement of melasma. And 3 years ago, I started to use the second generation Sylfirm X, which featured dual wave and more electrothermal reaction. The newer version, Sylfirm X, retained the pulse wave technology that can treat pigmentary and vasculations. And the Vivo human skin study using the Sylfirm with their new needle 300 micrometer needle depths. This study showed that after the treatment, they can decrease the promelanogenesis markers such as MITF, tyrosine receptor, and tyrosine receptor peptide 1 after the treatment. And the spatial staining also showed that there's a significant reduction of pigmented area and tyrosinase activity. And there's also a significant increase in collagen type 4 expression after the treatment. So for the Sylfirm X treatment, many physicians are curious about what needle depth should we choose to treat our patients. This study was conducted in 2018. The authors used the real-time ultrasound with two different devices to measure the epidermal combined dermal thickness for the real-life patients. And they found that in the cheek region, that the average depth of epidermal combined dermal thickness is about 0.8 to 1.2 millimeter. So if you choose the needle depth that was too deep, you actually sometimes hit the subcutaneous and deep dermal tissue. But for the melasma treatment, I believe that the main concern is around the basement membrane zone, that is the dermal epidermal junction. So for most of my patients, I choose the needle depths from 0.3 to 0.5 initially to target more at the basement membrane zone and the upper and the pulpoidermis vasculature and the senescent fibroblasts that are close to the melanocytes. And for some patients that have more erythema and more visible telangiectasis, maybe I will advance my needle a little bit deeper to the 0.8 to 1.0 millimeter for most of my patients. And many patients and physicians are interested about what's the result I can expect from the Sylfirm X treatment and how many sessions are required to achieve the visible improvement. In the following slides, I will show some cases to you for your interest. And this is the first case that after only one session of treatment, you can start to note that the pigmented areas start to decrease and pigmentation improve after only one session. And this is another case, and also after one session of Sylfirm treatment, you can see the improvement of the pigmented area. And this is the right side third quarter view. You can also see the dramatic improvement of the pigmentation, and also the senile antigen is also improving at the same time. And this is another male patient that who was a golf player with extensive sun exposure, and there's visible melasma lesions over his forehead and the lateral cheeks. And after 2 sessions, we can see the clear improvement of the pigmentation and also improvement of the skin quality, especially the pores over the medial cheeks. And this is another more mature patient with her 60 And after 3 sessions of treatment, you can see the improvement of her melasma lesions and the fine lines over the medial cheeks. And this is another case that it's only after 4 sessions, then the patient started to feel satisfied with the results. And you can see the clear improvement of the melasma over the lower cheek of this patient. And this is another patient that with 3 sessions of Sylfirm treatment, you can see there's a dramatic improvement of the middle and lower cheek melasma lesions. And this is another case we follow the patient for several sessions. After 1, 2, and 3 sessions, you can see the pigmentation gradually improve with time. And this is the result after 3 sessions of treatment. You can see the Y-shaped hyperpigmentation over the medial cheeks was significantly improving after 3 sessions of treatment. And you can see not only the pigmentation improve, but also the periareolar telangiectasis and the medial cheek pores also improve at the same time. And this is another case. It's after 6 sessions that the patient start to be satisfied with the results. And you can see a clearly improvement of the pigmentation and also the periareolar erythema and also pores over the nose and medial cheeks improving a lot after the treatment. So this is the left side view. You can see the improvement of the melasma and telangiectasis over the medial cheek and the nose area, along with the improvement of the pores and improving the skin quality for this patient. So this is another view. We can see a clear improvement of the telangiectasis, melasma, and the skin quality of this patient. So this is another case that we follow the patient for the 5 months. That after 4 sessions of treatment, you can see the gradual improvement of the pigmentation and the skin quality. So I would say that the clinical course is quite variable among individuals. But for most of my patients, we found that there are at least 3 to 4 sessions required for these patients to be satisfied with the results. So clinically, I suggest you can recommend your patients to receive at least 3 to 4 sessions to achieve the reasonable results. And this is an interesting case that we follow this patient longer. After 10 months of the treatment, you can see that the patients come back to the clinic for a maintenance treatment. And when we take the picture and follow up with patients, we actually can notice that even after 10 months after the last session, we can still observe the improvement of the pigmentation without recurrence. So after we stabilize our patient's skin with Sylfirm, we can actually make the melasma less relapsing. And for some cases that were refractory to the traditional modalities, I also like to use Sylfirm to treat these patients. This is a case that having been treated with different modalities such as the nanosecond anti-yac lasers, 1064 picosecond lasers, IPL, and even the dye laser for almost 10 years, but end up having this hyper and hypopigmentation. And we arranged a total of 6 sessions for these patients. And as you can see here, and after 6 sessions, she get a lot of improvement of his mild hyperpigmentation and also the telangiectasia. And because the patient was reluctant to receive the picosecond laser and other energy-based devices, but the patient still complained that she want to improve more. So we discussed with the patient that after stabilizing your skin, maybe we can consider combining with the picosecond laser later in your treatment protocol. So after 6 sessions, I suggest the patients to combine with picosecond lasers at the same time. using the low fluence energy. So then after the 6 sessions, I arranged another 3 combination treatment with Sylfirm and Pico, and we can see that even after 6 sessions, we can still get a little bit additional improvement for this patient's pigmentation. And this is another case with severe rebound hyperpigmentation after treated with high fluence picocycle lasers in our clinic. And we try our best to treat the patients with Sylfirm for a total of 3 sessions for these patients. As you can see here, and after 3 sessions of treatment, we can improve the rebound hyperpigmentation significantly in this case. And this is the right side view. You can see that the improvement of the rebound hyperpigmentation and telangiectasis for this case. And this is also another case that was very difficult to treat refractory hyper and hypopigmentation after several years treatment journey. And after 3 sessions of Sylfirm treatment, we can more even the skin color for this case. And from the left side view, you can see we can improve this residual hyperpigmentation for this case. Although we cannot improve the hypopigmentation, which due to the permanent damage of the melanocytes, but we can still improve the general skin tone by improving the hyperpigmentation for this case. This is the right side view. Now, after 3 sessions of treatment, we can still get additional improvement for this lady. And since the pulse wave technology can also target the blood vessels, so sometimes we also use the Sylfirm X to treat the erythema either associated with acne vulgaris or rosacea or your other inflammatory skin dermatosis. This is the case published in 2023. And after 3 sessions of Sylfirm at 4-week interval, we can see the improvement of the acne-related erythema, and also speculated that the mechanism is associated with collapse of blood vessels and downregulation of VEGF-A. And this is a quite new paper which is published last year. And the authors used the Sylfirm X to treat the inflammatory acne vulgaris. They used quite aggressive parameters, including 5 passes with parameters using the pulse wave form mode from the 3 millimeter to the 0.5 millimeter. The power level is from 7 to 4 respectively. And you can see that after 4 sessions of treatment, you can see a dramatic improvement of the pimples and pustules over the cheeks. And there are over 80% of patients have at least a grade 4 improvement in this study. And this is my case with popular pustular rosacea. I used the Sylfirm to treat this case with topical Metrogel, and after 3 sessions of treatment, you can see there's a great improvement of the papular pustule and telangiectasis over the medial cheeks. And this is the right side view. You can see the improvement of the rosacea in this case. And this is another case that she presented with melasma combining inflammatory acne. And after 4 sessions of treatment, you can note that not only the improvement of the melasma, but also improvement of the acne lesions. And this is another case with some solar antigens, some uneven skin tone, and some inflammatory papules and pustules. And only after 1 session, we can have this result in this lady. And in what situation I will combine Sylfirm with Pico? Most time when the patient presenting with superficial pigmentation like freckles, lentigens, and also care about skin quality, they want to improve these problems at a quite short time. I will combine these 2 modalities. This is a case that I combine Sylfirm with pico or lasers to improve the skin quality and the superficial lentigines. And after one session, you can see a great improvement of the pigmentation and the skin quality. When you look at the light reflex, you can really notice the skin quality improvement with the Sylfirm technology. This is the right side view. You can see the improvement of the skin quality and the pigmentation at only 1 month. So the Sylfirm X also feature a continuous wave, which can be used for skin rejuvenation, tightening, lifting, and scar treatment. As we know that there are a total 8 modes for the Sylfirm X. And for the scar treatment, I usually use the CW3 and the CW4, which have a longer posturation that can really modulate the extracellular matrix and disrupt the fibrospan in scar tissue. And for fine lines and pores, I usually use the CW1 or CW2 to treat these minor skin quality problems. And for skin quality improvement, most patients are really concerned about their pores over the nose and middle cheeks. This is a middle-aged woman that after 2 sessions of treatment, we can improve the pores at this extent. And the clinical paper also showed that we can combine other ingredients such as polynucleotides in this study for treatment of periorbital wrinkles. But in my experience, I found that with Sylfirm treatment alone, we can already improve the periorbital conditions very well. Such in this case, then after 3 sessions of treatment, you can clearly see the improvement of the fine lines in not only the upper but also the lower eyelids in this lady. And this is another more mature patients with 3 sessions. We can improve the upper and lower eyelids and periorbital wrinkles and crow's feet in this lady. And this is another case. And after 3 sessions, we can improve the periorbital conditions and sometimes even improving the dark circles for some patients. And this is another case with very difficult to treat upper medial wrinkles, and after 3 sessions, we can see this result. And the Sylfirm X is also very effective for treating the acne scarring. And this is a case with atrophic acne scarring over bilateral cheeks. And after 1 session, because the patient was so busy, they don't return to the clinic again. But when we call the patient to come back after 4 months, actually we are so surprised with the results. As you can see here, several visible atrophic acne scars. And after only 1 session, we can treat that there's a great improvement over this area. And we take a look at the left side of these patients. We can find that this atrophic acne scarring and rolling scars are much improved after only 1 session of treatment. And this is another sign that you can see how we can treat this uneven rolling scars after only 1 session of treatment. For acne scarring treatment, I usually use 2 or 3 different depths of needle penetration. Like maybe in this case, I use 1.5, 2.0, and 2.5 millimeter to target the deeper fibrous bands of these patients. And this is another case with the visible acne scarring and pores over the medial cheeks. And after 2 sessions of treatment, we can notice the improvement of the medial cheek pores and acne scarring. And this is another case that after only 2 sessions, we can see the improvement of the acne scarring over the temple and medial cheeks. And when we zoom in the face, you can see the improvement. And this is another case that also have the acne scarring over the temples. This is over 3 sessions of treatment. and you can see the improvement of the atrophic acne scarring, and this is the cheek improvement. And when we zoom in the face, you can see the improvement of the temple acne scarring after 3 sessions of treatment. So my early experience with Sylfirm in my clinic is that I now believe that the Sylfirm X is an etiology-driven, energy-based device for melasma. And it's for me, it's almost a game changer for severe and intractable melasma that was almost refractory to the current medical devices. And they can also treat the various vascular skin conditions, including the rosacea, acne, and the post-inflammatory erythema in our patients at the same time. And it is also a new treatment options for skin quality and improvement, especially large pores and depressed acne scars. Thanks for your attention.
Thank you, Dr. Chen, for such an informative lecture. We'll now move on to the Q&A session. Dr. Chen will address the questions submitted through the Q&A panel one by one. All right, let's start with the first question. First question goes, how do you Sylfirm X treatment parameters based on the type of melasma? Pigmentary, vascular, or mixed?
Okay, this is a great question. Just like I mentioned previously, the pathology of melasma is mainly near the basement membrane zone. So I suggest for melasma patients, we should start from the 0.3 to 0.5, which target the basement membrane zone area. And for more vascular type of melasma, maybe you can advance the needle to the 0.8 to 1.0, but it depends on the Fitzpatrick phototype of your patients. If your patients had the darker skin type, I suggest you start from the shorter needle, like 0.5 to 0.8, if it's very vascular. And gradually advance the needle to deeper depths. And for the power setting, I usually start from the level 3 to level 5, but average is level 4.
Okay, thank you. The second question is, when melasma and erythema coexist, how do you determine the appropriate parameters for Sylfirm X treatment?
Okay, if the patient combine melasma with erythema, initially I still focus on the treatment of melasma because as we know that for most melasma skin, their melanocytes are quite unstable. If you use deeper needle depths or higher energy setting, actually sometimes we get the pigmentation worse than the baseline. So I also recommend starting from the 0.3 to 0.5 to treat the melasma for the first 2 or 3 sessions. And if the erythema does not improve a lot, maybe at the 3 to 4 sessions, you can start to advance your needle deeper to 0.8 to maybe even 1.2 with higher energy levels, such as the level 6 or level 7. But I recommend it's only be used after the stabilization of melasma. Like if the melasma already improved a lot and there's no rebound hyperpigmentation and the condition becoming stable, then you start to adjust your needle depths to a deeper one and adjust the energy level more to your patients.
Okay. The third question is, have you encountered cases where pigmentation darkens temporarily after the treatment? If so, how do you manage post-care in such cases?
Okay. To be honest, I didn't have the case that actually got the worsening of like pigmentation after the Sylfirm X treatment because just as I mentioned previously, I'm kind of using more conservative parameters to treat my patients, especially in the first 3 sessions of treatment. Because if you use this conservative setting, that it's almost impossible to worsen the pigmentation, because you use a very gentle needle depth and very gentle energy to repair the basement membrane zone, to coagulate the upper the vasculatures, and to ablate the senescent fibroblasts very gently. But in case you have patients that get worsening after the treatment, you have to consider if your needle depth is too deep, if your energy setting is too high, or if you go too many passes for the melasma lesions that irritate the melanocytes too much. So if you found any conditions of worsening, I suggest you you maybe allow your patients to take a rest for 1 or 2 months with topical agents or oral tranexamic acid to stabilize the lesion. And after the worsening of the pigmentation improve, then you restart the treatment with Sylfirm. This is my recommendation.
And the next question, for acne scar treatment using the CW mode of Sylfirm X, what are your recommended settings?
Okay. For the acne scarring, it depends on the depth of the atrophic acne scarring or hypertrophic acne scarring. But for a shallow atrophic acne scarring, I usually use maybe double or triple treatment depths, like 0.1, 0.5 to 2.0 needle depths. But for more deeper acne scarring, that I supposedly the fibrospan can extend to the subcutaneous layer. So maybe I will go a little bit deeper to the 2.5 or even 3.0 millimeter to target the deeper the scar tissue. But at that time, you have to increase your power setting, like level 8, level 9, when your needle go deeper to the subcutaneous layer, because as we know that the null effect, the electric current, the coagulation is actually from the deep to the superficial. So if your needle depth is adjusted to a deeper level, and you should also level up your energy to hit more tissue from the deep to superficial. So this is my recommendation.
Okay, here's last question for the webinar today. Do you use multiple modes like PW and CW combined within a single session? If so, under what conditions and for what purposes?
Sorry, can you repeat the question again?
Oh, yeah, of course. You use multiple modes like PW and CW combined within a single session? If so, under what conditions and for what purposes?
Okay. Thank you. Yes, I do combine with pulse wave and continuous wave at a single patient. Because as we know that the patient may present with different skin conditions at different parts of their face. So, like for melasma patients, like if their pigmentation are over the middle cheeks and forehead, but they're really concerned about the nose pores and periorbital wrinkles. And I will use the pulse wave, like pulse wave PW2 with level 4 to target their melasma lesions. But for nose pores and the periorbital wrinkles, maybe I will use the CW1 or CW2 with like 0.5 to 0.8 millimeter needle depth to target the periorbital skin and also the nose pores. So it depends on the different skin conditions of your patients. like as you can see in one of my case that she presented with the melasma and inflammatory acne lesions. That case, I used the PW2 mode to treat the melasma lesions, but for the inflammatory acne, I used the PW3 and PW4 to target the inflammatory of the acne. Before her nose and other fine wrinkles, I use the CW1 to gently but slightly prolong the post duration to have a more rejuvenating effect for the skin quality improvement. So definitely, I will combine different modes to treat different indications of our patient's face.
Wow, thank you, Dr. Chen, for such amazing and practical, informative answers. Actually, we got a lot of Q&A questions than this. Unfortunately, due to time constraint, we'll have to conclude the Q&A session here. But don't worry, any unanswered remaining questions will be addressed via email individually within 2 weeks. So, okay, and as we come to the end of today's session, we'd like to extend our sincere thanks. Dr. Chen, could you please move on to the next slide or last slide?
Okay.
Yeah, thank you.
Thank you.
Yep. Dr. Chen, we truly appreciate your time and the valuable insights you shared with us. And to everyone who joined us today, thank you. We hope you found this session both informative and engaging. If you have any further questions, feel free to reach out to us using the contact information shown on the screen at the bottom here. And we look forward to seeing you at our next webinar. Until then, take care and goodbye.